Good morning, good evening, dear friends and colleagues and members of ADI. It is with great pleasure that I give you this speech today. Now, if you can bear with me a second, I am Paola Barbarino. I am the CEO of Alzheimer Disease International, for those of you who do not know me. And I'm going to try and share my screen and presentation in a second. So let's see if we can pick it up. There we go. I hope that you will be able to share it with me and see what I am seeing. So today I have been asked to talk about World Alzheimer's Month, the campaign that we are about to close and for which you have been working so hard for so long. So the tagline for this year was, as you know, time to act on dementia. Before I do that, a few words about ADI. We were established in 1984. We are an umbrella organization of 105 Alzheimer's and Dementia Association around the world. ARDSI is one. We represent our members, EU, at the WHO, the UN, at the OECD, at the G7, G20, etc. We are the promoter of World Alzheimer's Month and the publisher of the World Alzheimer Report and other reports. Our vision was and continues to be that prevention, care, and inclusion are important today, as the cure hopefully will come tomorrow. Our strategy, you can see quickly here, we were founded in the 80s. We built a network for many years that allowed us now to have 105 members. Often there were not members in countries that worked on dementia or Alzheimer. Then we were accredited with WHO and the UN. We advocated to have a global dementia action plan, which was approved in 2017. And since then, our work, which has been kind of bottom up, has then become top down. We have tried to make sure that at national level, governments are aware of the Global Dementia Action Plan, because even if they signed it, it doesn't mean that everybody knows about it. And then that this has basically resulted in national level action plans. As you know, we still don't have an action plan for India. Meera Pattabhiranman, who will speak at this Congress as well, will tell you more about ADI position in that respect. But I'll tell you more instead about World Alzheimer's Month, which is what the globe represents. That has been our other side of our strategy. We've tried to make sure that awareness for dementia reaches a global audience. If you think about it, probably we know that there's about 200 million people in the world that are aware about dementia. 55 million live with it, and the families around them and the professionals around them, we estimate around 200 million. But if you think the world has 7 billion people, and of course you're in India, one of the most populous countries in the world, there is still a lot of people that we have to reach. So I'm focusing today on our work to raise awareness globally. Let me tell you briefly before though about the global impact of dementia. This, as you know, originally were ADI's figures. Every 3 seconds, someone in the world developed dementia, is bound to become a $2.8 trillion disease by 2030. And the estimated growth of people living with dementia in 2030 is 78 million, growing from 55 million in 2019. It's a massive growth. But let me tell you about World Alzheimer's Month. So every September, people come together from all over the world to really work together and to raise awareness and challenge the stigma and misinformation that persists around dementia. September 2024 will mark the 13th year of this vital global awareness raising campaign. As I speak to you, it's just a few days before then. And World Alzheimer's Day is on the 21st September, which was established in 1994. Below you can see some of the graphics that have been used in these years for World Alzheimer's Month. And I beg your pardon, there we go. In the Global Dementia Action Plan, it says that recognizing stigma, discrimination, and disinformation surrounding dementia was prevalent globally, and targets were included for awareness campaigns. ADI has been instrumental and a leader in trying to make sure that these targets have happened, but also because a lot of governments are not trying to meet these targets, or maybe they've met them one year but not other years. We try and ensure through our members, through all the people in the world, and there is many of you, that are interested in dementia, that we still try and make sure that every year, for a period of time, Alzheimer and dementia are on top of people's thoughts. And you can see here some of the efforts of our members in trying to lift up landmarks and monuments around the world that make people not forget dementia is so important. World Alzheimer's Month is growing. So in 2018, we started counting how many interactions on social media. There isn't many things we can count, but we can count that. And as you can see, with the same metrics, this has been going up every year consistently, apart from 2022, when sadly Elizabeth II passed away, the Queen of England, and the media was focused on that rather than on World Alzheimer's Month. But otherwise, we've grown very consistently. And here is for you to have some idea of the engagement. As you can see, we are having lots of newspapers and lots of magazines and lots of places everywhere covering World Alzheimer's Month. The theme for 2024 campaign will be Attitude to Dementia. The campaign seeks to address, as you know, because it's just at the end of September, educate the stigma, discrimination, and misinformation that surrounds everything in the world around dementia. The campaign is online, media, and in person, and we are running a special campaign in the Americas with WHO, Pan-American Health Organization. Also, we are using specific tags that I would urge you to use, even if there is only a few days left, but these count, because the only way that we can measure these is if you use the tags at the end of the slide: time to act on dementia, time to act on Alzheimer, and World ALS Month. These are the tags that you need to use. You can use them in your language and we will still count them. These are some of the material this year that we are using for World Alzheimer's Month. As you can see, a lot of them and a lot of different countries and a lot of different languages. All of our material can be found using the QR code below. Even if World Alzheimer's Month finishes at the end of September, you can still obviously make use of these codes. I now want to pass to another point. ADI is the publisher of the World Alzheimer Report, as you know, and that is a publication that aims to have groundbreaking evidence-based information, but provided in a clear language that also is very important to raise awareness. And typically, we launch the World Alzheimer Report on World Alzheimer Day. So I'll tell you a little bit about what we did on the 20th of September when we launched the World Alzheimer Report. And here you can see some of the cover of the previous few ones. So the World Alzheimer Report 2024 will focus on attitudes to dementia. ADI has surveyed over 40,000 people living with dementia, carers, healthcare practitioners, and the public on their views on dementia. Individuals from 166 countries participated in the survey, with 35 different languages represented. The report will seek to understand how the world perceives dementia and how this has changed since 2019. So I'm sure that you will have taken part of that, and most importantly, thank you if you did fill the survey that led to the report. The findings are very astounding, and here I'm going to focus on a few. One important one, because now we have a baseline, because we did a similar report in 2019. So now between 2019 and 2024, we can measure what's happened in the last 5 years. In 2019, 62% of healthcare professionals, so that's doctors and nurses, said that they believe dementia was a normal part of aging. And this is obviously not true. Dementia is a condition caused by a number of diseases, one of which, and the most prevalent of which, is Alzheimer. And so now we have 65% of healthcare professionals that believe that. So that just tells you how much more information, awareness raising, but even education of healthcare professionals we need to do in order for people to even have a diagnosis and for their dementia symptoms not to be dismissed as just normal aging, which is not. And if people don't have that, then they will not be able to access, for example, the services the ARDSI provides, the support group, care at home, better organization of their own space. So we do need really urgently to educate our healthcare professional better on dementia. Other findings, the 80% of the general public thinks dementia is a normal part of aging, a dramatic increase compared to 66% in 2019. So, okay, the healthcare professional is even more shocking, but also 80% of public continues to think it's about normal aging. Between 29% of the general public in high-income countries and 32% in low and middle-income countries felt that people with dementia are dangerous more often than not, and very significant increase in 2019 in high-income countries from 16% in 2019 to 29% in 2024. So we clearly need to do something about this message. Over 64% of the general public believe people with dementia are impulsive and unpredictable, which is also quite sad considering all of our efforts in awareness raising. Over a quarter of respondents from the general public expressed the belief that moving a family member from dementia to a care home, even against their wishes, would be the best option. This number increased significantly in lower income countries since 2019, from 9% to 33%. And this tells you a big story, doesn't it? Because, of course, we do need to raise awareness about the importance, for example, and sometimes the preferability of having people staying in their own home rather than moving to a care setting. And about discrimination, which is, of course, the underlying issue. So why people think this? Because there is still a lot of stigma. 88% of people living with dementia indicate experiencing discrimination, up from 83% in 2019. And bear in mind, we had over 800 respondents living with dementia for this survey. People with dementia say that 36% stopped applying for or continuing work, 29% avoided or discontinued close personal relationship, 31% avoided social situations due to concern regarding the reactions of others. And you that are all specialists will understand how terrible this is, because of course, if you cut yourself off, your rate of cognitive decline could be faster. And we all know that sadly, when you develop one of the diseases leading to dementia, the progression could be slow, especially if you are diagnosed young. And therefore, there is no reason for you to cut off all contacts with the external world, because the disease may progress very slowly. But of course, if you feel that others will judge you because you have dementia, that may constitute a problem. You really need to read the report because it goes into these issues in much greater depth. Of the carers, 43% stopped inviting friends over due to concern about they may treat their loved one, and 47% stopped accepting invites to visit friends or family, again causing isolation to themselves, to the person living with dementia, and probably deterioration generally in their social interaction and possibly their mental health. Over a quarter of people globally believe there is nothing we can do to prevent dementia, with an increase from 2019 to 37% in lower and middle income countries. And that is bad too, as we do know now that 40%, up to 40% of all cases could be prevented adopting better lifestyle choices. And that was what we talked about in the World Alzheimer report last year, 2023, on risk reduction. So if you're wondering what can you do in order to prevent dementia, you really should read that report and subsequent papers that have come up after that, which you will find more information about on our website and social media. More than 90% of carers and respondents from the general public said they would be encouraged to get a diagnosis if a disease-modifying treatment was available, and that's very positive. So it's important to think about disease-modifying treatment, and it's important that the government of India start thinking about that, because these treatments are coming in on the market. People will want them. As far as I know, in India, still getting a diagnosis is very difficult, and as we said, a lot of healthcare professionals still don't understand how dementia is a not caused by normal aging, but is a series of diseases that then lead to a condition. Over 85% of health and care professionals say that they would be encouraged to give a diagnosis if there was a treatment that could prevent or slow the progression of dementia. So you can see how healthcare professionals may change their mind quite rapidly if there is a treatment. More than 80% of the general public believe that they can change the support provided to people with dementia through their vote. And this is so important, especially in a democratic country like India. People think that you can vote yourself better. So that is very heartening. And I would like to make you think, ARDSI, about this, because you can make a change. You can advocate for change through the vote. So elections are an opportunity for us, advocacy organization, to persuade governments to do more. Among the general public group, most respondents felt more confident to challenge stigma and discrimination than they did in 2019, especially in high-income countries. So this is great. And over 58% of the general public believe dementia is caused by an unhealthy lifestyle. And this is good. It goes back to that risk reduction issue. So this number increased since 2019 across high-income countries and upper-middle countries. However, it decreased dramatically in lower-income countries from 78% in 2019 to 58% in 2024. So remember, we need to talk more about risk reduction. People need to understand that you can actually do something about dementia by having a better lifestyle. We have launched the World Alzheimer Report. That is what it looked like. Hopefully you will have attended the webinar on the 20th of September. You can scan this QR code to download the report, which is available completely for free from our website. And now I want to close this presentation with a call to action to please join the conversation during World Alzheimer's Month by sharing ADI's posts with your networks or posting on social media using those hashtags or the hashtag @WorldAlzMonth. You can use them in your language if you wish. And please read the World Alzheimer Report and make sure that the Indian government, please start thinking about a national dementia plan again. We desperately need one. There are new treatments on the horizon. There is a lot of stigma still to be worked, and there are big countries very close to India, like China, that have a national dementia plan, and they're getting ready. You need to get ready too. Well, continue to follow ADI as you normally do. We will be very happy to see you online for all of our activities. From me, from London, and from ADI London, a big goodbye. Thank you very much for listening to me. And remember to be in touch and let us know what you think of our activities. And be in touch and ask us to do more for you. Whatever you want us to do, we will. India is super important for us. We want India to have a national dementia plan. It's my next big step. And I know that together we can do it. ARDSI is amazing and we can get it done. Thank you so much. Goodbye.